guys, my name is Kim Waters. I am a physician assistant at OrthoVirginia, and I work directly with Dr. Jody Smith over at the St. Mary's Greenville location. So the ACL is the anterior cruciate ligament. This is a ligament that is directly inside your knee here, and it is responsible for stability with any cutting or pivoting in sports. Unfortunately, ACL tears or ruptures are very common injuries that we see in our athletes, and oftentimes they require surgical intervention. Because of the nature of ACL tears, we can't really go in and repair them in the traditional sense, meaning that we can't go in and sew the ACL ends back together. Oftentimes, we have to do something called a reconstruction, where we make the ACL out of something else. And there are 3 different grafts that we use to do that. One is an allograft, so this is a cadaver graft. So we use a donor tissue that then serves as a new ACL. The benefits of an allograft are they're often less painful for patients, and they're a little bit quicker back to activity. And so these are a really good option for patients who are not doing a lot of cutting sport activity. The other 2 grafts that we use are autografts. So autografts mean that we take the graft from the patient's own body and use that as a new ACL. And there are 2 types of autografts that Dr. Smith and I routinely use. One is the patella tendon autograft. So we make an incision right here above the patella tendon. We take a little piece of the patella, which is the kneecap, the middle third of the patella tendon, and then a little piece of the tibia below. And this is often referred to as a bone tendon bone graft as well. The other graft that we use is the quadricep tendon autograft. So you make an incision above the kneecap and we harvest a small piece of the quadricep tendon, usually about 8 to 10 millimeters in diameter, and that becomes a new ACL. The difference between the patella and the quad and which one to use really varies based on the person. So we take into account patient's age, what sport they're doing, the type of occupation they have, and a bunch of other factors. And that's something that Dr. Smith talks directly with the patient. The autografts are really the superior grafts for patients who are trying to get back to sport. So we use the autografts primarily in our younger athletes or adult patients who are still playing soccer on the basketball court doing a lot of cutting activity. Those are the 3 types that we use, and we're happy to have you come in and talk about each graft. And if unfortunately you find yourself in that situation, come in and let's have a chat. And thanks for listening.